we start, tell us first of all, why do we need to test for coronavirus? There are people out there who are saying we're making a big deal. What is testing and why?
You know, we had a saying when I trained in public health. It's that if you're not testing it, it's not really happening. Mm-hmm. We can't really tell. The analogy I give to people when I talk to them is, I want you to imagine yourself in a dark room and it's pitch black. You can't see anything, and you feel the surface of a table, and you're in the center of that table, and you can't tell if that table is 10 feet wide by 5 foot long. You can't see how big that table is. You can only go by feel, and you feel just that surface, and you keep feeling around until you get to an edge, and you've got an edge, and then you run your fingers along that edge until you get to a corner, and that corner now is you're starting to get your arms around this problem. Our fingers touching that tabletop are our testing. And without this, we don't know how big of a monster we're fighting. We don't know how scary it is. We don't know, are we going to stumble over it in the dark, or is it just a tiny little place that I can just set my drink on and not worry about? So we need to measure that table size.
So testing is
vital.
It seems like here in the United States, we need to do a better job of testing.
Yeah, you know, testing is important. I think testing is the cornerstone of one of the pillars of public health. Again, if you're not testing it, you can't prove it. You can't prove that it's bad. You can't prove that it's good. But we need to prove this is high fatality rates, a low fatality rate, high prevalence in the community, not a lot of prevalence in the community. And the way we do this is testing. You know, you look at some other countries that seem to be doing better on their responses to this epidemic and this pandemic. And it all centers around a very robust testing platform. You know, you look at countries like South Korea, you look at Italy, places like this where they are really penetrating into their community, and they're really able to test a variety of ways, and they're making it easy to get tested. You've got to bring the mountain to Muhammad, so to speak, rather than trying to get people out. You've got to make it easy to test.
Yes.
And you need to have a lot of testing everywhere. I think certain areas require more testing depending on the activity and the tempo of the disease and their geographic region. Mm-hmm. But you need to be testing a lot of areas. This is the cornerstone of good public health. You know, there's a lot of ways to track if we're testing good or not. You can look at just the sheer number of tests. Mm-hmm. You know, we're doing 50 tests a week. Well, that's good if you've only got 50 people in your region. If you're doing 50 million tests a week, well, that could be bad if you have an enormous global population. So raw number of tests is good, but that doesn't always give you a fair bias based on the population of the people that you're testing as a community. Well, then you can also, I'm sorry, go ahead.
No, I was going to say, speaking of that, so like here in the United States, there are 330 million of us. Mm-hmm. How many of us should we be testing of the 330 million? If you look at state to state, given that different states have different populations, is there like a percentage that we should be shooting for to really have a sense of what's going on in our community?
Yes, yeah, there is, you know, and these are numbers based on past epidemic knowledge that we've learned from previous outbreaks in various locations around the world throughout, you know, from public health growing up from cholera wells in London to where we are today. And a good general number that I'm seeing and I'm starting to feel comfortable with is around 2 to 3% of your population. And I think that's a good number to kind of shoot for. You know, you look at countries like Italy, Korea, they're in the 2 to 3% range of who they're testing. And that's a good number to aim for. I think the US right now is coming in at around a hair under 1% of our testing. We're coming in around 0.008 roughly on the number of people that we're testing of our population. There's another statistic that I like to look at that is, I believe, a little bit more accurate, is you want to have a lot of positives, but you only want 10% of your positives. Yeah. So if I'm testing 10 people, I only want one of those people to be positive. I want my other 9 to be negative, because that means I'm casting such a wide net out there that I'm finding the edge of that table, and I know where the squares are, and I can then start drilling down on my sick people. So that goal of 10% of your test being positive is also a very, very important number that I think we're going to start to see a lot more of in the future. Well,
right now, clearly, we are under testing.
Yes, sir. Yes, ma'am, we are.
Yeah.
Yes, we are. We are under testing.
Because, now you can see the ticker scrolling across on the bottom, and a lot of people have been focused on that and said, well, clearly the United States is testing a lot of people. But what you're sharing now is, if we're aiming for 2 to 3%, 2 to 3% of 330 million is somewhere around 6 million to almost 10 million people. So we still have a long ways to go in terms of tests.
We do. And looking at that percentage of positives and in your total group that you're testing, New York City, a hot spot in this here domestically in the US, they're having 20 to 30% of the people that they're testing are still coming back positive. So you need to amplify that testing circle and test more to get down around that 10% range. I believe Italy's coming in, they're testing now and they're getting around 8% of their positives, which is good. They've got a good idea who's sick and who's not sick. And that's really our goal right now.
And the whole goal of testing is so we can have containment, right? We don't know if we're containing things if we haven't tested enough people to assess the rate of spread.
Yeah. Again, if you're not testing it, you can't measure it. So I would be interested specifically in knowing who's sick now, who is at risk for getting sick. And I'm really, really interested in who was sick 2 weeks ago and is now better. Because as we start